for 7 years.
Pearl Fuel is doing something she wouldn't have dreamed of a year ago. She's getting ready to take a hot air balloon ride without any of her old fear. Not fear of flying, but fear because she used to suffer from urinary incontinence. It's a common problem that affects about 30 million adult Americans, mostly women, and it's not something they like to talk about.
I think that you keep it to yourself because there's a stigma involved, or so you think there's a stigma involved.
Fewer than half of incontinence sufferers seek treatment out of embarrassment or the belief that incontinence is a natural part of aging.
Whoa!
Yet for active seniors like Pearl, the symptoms can be debilitating.
I started to notice that maybe the effort of climbing or the running, I used to play softball and things of that nature, that I couldn't do it because I didn't know what was going to happen, basically.
What would happen were bladder leaks, which often occur when damaged or weakened muscles let urine escape. That's called stress incontinence. But Pearl also experienced urge incontinence. That's when misfiring nerve signals tell the bladder to contract. Those spasms can steal the spontaneity from life.
You start out in the morning, you say, okay, how much water shall I drink? Should I have a cup of coffee? Should I have that extra cup of tea? Because I know I need to have X amount of time before I need to be in a restroom. So you change your entire life based upon a need to have a restroom nearby.
As Pearl's problem grew worse, pads may have helped her cope, but they did nothing for her confidence or well-being. There went carefree days traveling the world with her husband John, digging in her own garden, playing with the grandkids, even hot air ballooning. The fun had all fizzled. Yet this highly trained psychotherapist suffered in silence for at least 7 years before talking to her doctor.
It took me that long to say, hey, I've had enough.
Her gynecologist recommended time-honored Kegel exercises. Done right, they strengthen pelvic floor muscles to stop bladder leaks and help resist spasms. Pearl also tried medication, but found it gave her dry mouth. Enter Dr. Robert Gutman, a urogynecologist she went to see about a year ago.
Hi, it's Dr. Gutman. How you doing?
I'm doing fine.
Nice to see you. Well, when I met her, she had been living with this condition for 15 years. She had sought physical therapy. She had done biofeedback to strengthen her muscles. She did behavioral modification and time voiding, where she actually went at set intervals.
Dr. Gutman started looking for underlying problems.
Are there conditions such as diabetes, Parkinson's disease, multiple sclerosis that could be contributing to it? Have they had prior surgeries, hysterectomy, that had a sudden development of incontinence afterwards?
He also asked about possible medicines like diuretics used to treat high blood pressure that can make the condition worse. Then he moved on to tests that show the patient's ability to empty and support the bladder.
Actually have a seat in the chair here. We leave the room and we want to measure how they're emptying their bladders.
Pearl's tests proved her bladder spasms were under control, but weakness under the bladder neck resulted in leaks.